We're live. Hello, everyone. This is Steve Coleman, Stevie B at PTC with another episode of PTC Live, where we give you in-depth and insightful information into all the wonderful programs we have available for students here at Piedmont Technical College. We're going to jump right into it today because we've got a big show with a lot of information that needs to be shared. We're talking today with Miss Tara Gonce. Tara is our Dean of Healthcare. Tara, how are you today?
Hi, Steve. I'm doing great. How about yourself?
I'm doing well. It's great to have you on. I know how busy you are. I know how many things and how many irons you have in the fire, but we just want to give you an opportunity to talk about one of the really large programs that we have in terms of the number of programs that you're in charge of, and also very, very popular programs as well. When we start talking about the healthcare programs on campus, you know, we have people in communities all over that are representing the college that you and your staff have trained and have put out in our communities to help people in a myriad ways. So let's get started. You can tell us a little bit about yourself, and then we're going to dive into medical assisting, and we're going to go through the rest of our program.
Okay. Well, you know, I could probably talk all day about all of our programs because I think each and every one of our programs within the healthcare division are spectacular. I will tell you just a little bit about myself. I am actually a Piedmont Tech graduate. So I graduated from the nursing program here and worked in the hospital as an ICU nurse and an OR nurse. I came back here in 2000 and started my career as a nursing instructor. Over the years, moved into a department head position and then Dean of Nursing and then eventually Dean of Healthcare a few years back. So it's been very exciting. Nursing is my specialty. Nursing is my passion. But I have learned to love a lot of these other programs that are now within the healthcare division because I feel just as passionate about those programs as I do nursing. And the interesting thing is to be over a division with all of these different healthcare careers, you can see how each one impacts the patient, how each one is so vitally important to patient care. And so I think that that's what one of the most wonderful things in being in this position is seeing how all work in a finely, it's like a well-oiled machine.
That's excellent. Great. Well, let's get started. Let's talk about medical assisting. Give us an overview of what the medical assisting program is.
Well, I'm going to tell you, the medical assisting program here within the healthcare division is a fantastic program. Debbie McCallum is my program director for that program. And as she states, her program rocks. And I completely agree with her on that comment. I asked each of the program directors this morning to kind of give me some tidbits of information, just some updates on their program. And she wanted to let everyone know that she has a new class starting in August. And she's very excited about that she has all of her spots filled. And that her current senior students who have been kind of on hold and in an incomplete status due to the pandemic, and we're probably going to talk more about that as we go on with the session, they're going to be starting their medical assisting practicum soon. And we're very excited about getting back into the facilities because we've been out of those for a few months. Sure. Medical assisting is just to kind of give you a little overview of that program. They do a lot of nursing skills in the back of the office, but they also learn the front office skills. And so it's kind of a combination program that they have, or a combination of skills. And Debbie does a great job. Debbie's also one of our graduates from our nursing program. And as you'll see throughout the session, we have a lot of our Piedmont Tech graduates as our current faculty members and program directors that we're very, very proud of. So can't go wrong with medical assisting program.
Yeah, I think that's awesome, particularly to have so much experience in the field and to bring the real life experience into the classroom and as in your leadership role with your instructors in the programs. Pharmacy technology.
Pharmacy technology. Clay Sprouse is the program director for that one, and he has been doing a phenomenal job in this program. He is each and every day he sends me a message to tell me what new student he has starting that program, and it just makes me really happy to hear that. One thing that he wanted for us to mention is that he's been working with Purdue University's Penguin Innovations to bring a new simulated classroom into his program. With the pandemic, we've had to really rely on a lot of simulated activities or simulated clinical experiences, especially when we were not able to go into these real life clinical areas. And so with this particular program, they're going to be able to prepare intravenous medications virtually and learn from their, they will see the successes that they have. And I don't want to say learn from their mistakes, but basically try to correct things before they actually get into the real life clinic scenarios. So this is a very exciting program that we have starting in the pharmacy tech program that's starting this fall with our new cohort of students. And so he is very excited to share this.
Yeah, Clay is probably one of the most exuberant people you'll find. If you stop by and ask Clay one question about pharmacy tech, you gotta break away from him after that, because he's going to give you the whole rundown.
Absolutely. And if there's one thing that Clay, well, with any of our program directors, they're all very passionate about their programs.
Absolutely.
They give 110%. So I'm very proud of them at all times.
Sure. Radiology.
I am really excited to talk about our radiology program, and I have to give a shout out to Lee, Dana, and Jerry on this one. The RAD program, through the pandemic, not being in clinical, has been able to complete all of their graduates on time for the summer. And
that is excellent.
13 students will graduate this summer and take their boards and enter the radiology profession. I know I've been working with Lee, Dana, and Jerry throughout the pandemic situation and us going to the remote learning. They have been so creative with their different types of clinics and doing things virtually and doing different strategies to get their students where they need to be. So I just commend all three of them, and try to send these students some good and best wishes, because they're scheduled to take their board exams within the next few weeks.
Sure. Cardiovascular technology.
Cardiovascular technology. We have Laura.
The heart people.
Yes, the heart people. CVT, even though I'm in nursing, cardiac is a specialty of mine. And so I love anything with cardiac. Laura Boone and Lena Scott are over in our CVT area, Laura Boone being the program director, and we have the echocardiography program as well as our invasive CVT. So it's two different programs if you don't know about those. But one awesome thing that, and it's not just one awesome thing, we have lots of awesome things over there, but one thing that I wanted to talk about today was the new vascular sonography certificate that we're going to start offering in spring 2001. This certificate utilizes ultrasound to perform diagnostic testing on patients' arteries and veins. It's primarily used for the diagnosis of blood clots, blockages, and aneurysms. And so we're really excited that our students and our graduates of these programs will get to have an add-on certificate in January, starting in January. And Laura Boone actually stated that the goal is to get more people cross-trained in multiple ultrasound modalities so that they can be more productive and well-rounded for hospitals and more marketable as graduates. And I think that that's important. So I know that we've been working on this. Laura's been working on this over a couple of years. And so we are just really excited to see this certificate come to fruition.
Well, just to add a little bit of a personal touch to the success of your CVT program, my cousin, whom I'm very close with and see all the time, Anisha Boozer, is a graduate of that program, and she's doing well and loving her career. She's all over the place doing a lot of things, but I remember when she was down in the program, she had just a tremendous time and spoke very highly of the staff, and felt like she had gained a degree that could help her with the rest of her life. So that's absolutely excellent. And that's a testimony from my family about one of the programs. There's many more I could tell you, but we've got to go on to surgical technology now.
Surgical technology. Well, like I said, the feedback that I received from this program with our instructor, and I want to kind of give a shout out to Lynette Thompson because she kind of said, she said, our program is exciting and the best. And there's a little bit of competition with our programs around here, because especially when it comes to comes to students. But the surgical tech program is awesome. Susan Keeney and Lynette Thompson, they do a fantastic job in this program. They are a one-year program and an integral part of the surgical team in the operating room. They're trained in sterile technique procedures, setting up other procedures, assisting surgeons, passing instrumentation that's needed for procedures, and they must be certified within 90 days after graduation to be employable. So, you know, this is a very serious job. If you've ever had surgery, you've had a surgical tech working with you. Mm-hmm. This is near and dear to my heart because I was an operating room nurse for 5 years. So I worked very closely with the surgical techs, and I actually kind of cross-trained as a first assistant. So you have to be very passionate about this job because it's tough. It's a tough job. Areas of employment for this particular program would be the surgical areas, labor and delivery, which I try to stay away from, anesthesia, they can be sales reps, and there are a lot of jobs available in this program. So very rewarding profession. And like I said, we have the just very dynamic faculty over there working in our surgical tech program.
Yes, and I would say that Lynette Thompson is probably is probably the director of comedy in your division as well. But yes, she has you've got a lot of wonderful people working for you, but she has a personality that's off the charts.
And she does a great job with recruitment of students and advising students because they remember Lynette. So it's and you know that's very important as faculty members.
I would go back just for a moment just to talk about, you know, we hear about these wonderful professions, medical assisting and pharmacy and radiologic technology, CVT, surge tech, and some of the others. Let's talk a little bit for a few minutes before we dive into the rest of them about where do these people work, Tara? Once you send them out with their certifications, all of them don't go and just work at Self Regional or Newberry Memorial. There are a number of other places and some really unique places where people in your healthcare, your health trained individuals can go and find jobs.
Well, I mean, like you said, they don't just work in our service area. They are all over the place. We have a lot of students that travel to and from Georgia every day to attend classes in various programs, and so they go back to those areas in those hospitals. We have a lot of them in medical offices. Mm-hmm. We even have some in community settings, like in community centers or in jails, prisons. So you know it's totally across the board. You can, you know, I think of nursing. You can even be a nurse on a cruise ship because people get sick on cruise ships. So the opportunities are endless with healthcare programs and healthcare careers.
And I wanted to ask that question because, you know, as I go through the communities and, you know, as we get older or we still think we can do things that we used to be able to do but can't, and then you end up with something that's hurting or broken, like has happened to me. I always find myself in situations where when I talk to healthcare students or if I'm in a healthcare facility, I'll always ask, where'd you go to school? And I'm knowing that more than likely they're going to say in our area, Piedmont Tech. And I'm proud of that myself, and I like to engage them in those kind of conversations. And so I just wanted our audience to know that our communities, our service district, Greenwood, Lawrence, Edgefield, Abbeville, McCormick, Newberry, and Saluda, is inundated with Piedmont Technical College trained healthcare professionals.
Absolutely, absolutely. You know, I find it quite interesting. Even and this is a testimonial to you know, the different programs, but when my family members go to different organizations to have healthcare treatments or something like that, I always hear about my mom, especially. She'll say, I met one of your students today, or I met one of your graduates today. and that's just really, it's a really neat thing. And it's really neat that, you know, of course, I have children, so we quite often have some doctor's visits or some ER visits. Mm-hmm. And it's really neat to see these students in action, from nursing to respiratory to radiology to the patient care techs to the pharmacy. I mean, you see the whole gamut all together. You see that whole entire healthcare team. Sure. And that's what's so important, that it's not just nursing. It's not just respiratory. Everybody has a role in treating that patient.
Excellent. Well, let's dive back in because we still got so much more to cover. Where did we stop? Did we stop at respiratory care?
Yes, I believe.
Yes. So next on our list is
no, we haven't talked about respiratory yet.
Let's talk about respiratory care.
Yes.
Okay.
Oh, sorry.
That's all right.
You're going to say something else. We have an awesome respiratory program, and one thing I want to. Sometimes they don't get the notoriety a lot of times because they are the one, and they need to, because they are the ones that keep us breathing. They are the ones who do the work that a lot of people are not sure that they would want to do. But this is a career that the country has been continually talking about and discussing over the past few weeks or past few months since this pandemic started.
Sure.
And they are the only ones that are trained in managing ventilators and life support. And they work with populations from newborn to the older populations. Ann Piggott and Christopher Martin, they do a fantastic job. And Carla, I have to give Carla Gillum a shout out because she still assists in our respiratory program with some of the clinics, and they are phenomenal. And I just can't say enough about respiratory. And I will also say that Ann has also helped out some of our area hospitals by sending our ventilators out and for those hospitals to use. As a matter of fact, she sent out 2 of ours last week to assist in those areas of need. And that it just makes us feel good as a division and as a program that we're able to help those organizations that have helped us. And so it's kind of a back and forth thing. So we're thrilled that we're able to have that connection.
Yeah, I was going to say, I'd assume that they were, 100 miles an hour right now in respiratory care, given the COVID-19 pandemic, and helping people to continue to improve and taking care of those individuals in those situations. One thing about our healthcare students is, it's real world immediately with all of these graduates. I mean, they don't have a period of time where they can say, I'm going to ease into this. You could be a nurse, a radiologic technologist, a CBT, a patient care technician, and immediately in your first day or first week of work, you're dealing with life and death situations, and you have to be critically trained in order to handle those situations.
Absolutely. And I think that our faculty does a phenomenal job in getting those students trained prior to, during, and even after. One thing that we pride ourselves in is the level of professionalism of our students. And I think that that's reflective on our faculty members and how they view the importance of professionalism. So it really makes me happy to see all of these students jump in, and they want to help. They want to be back in clinical. They want to be a part of this pandemic right now, and even prior to and after what we're going to face. It's they're there to help. They're there to get on the front lines, and that's basically what we're fixing to send these students back into, is the front lines with our other healthcare essential workers out there.
And Tara, I'd like to interject this as well in the form of a question, perhaps, or maybe a statement for you to comment on, in that, people will, when we talk about our programs, people think of the technical skills that a nurse or a cardiovascular technologist must have, and all of the tools that you've equipped them to be able to service individuals. But you guys also have a personal a part to the preparation of your students, and about how to go about handling people, empathy, how to talk to individuals. That's a critical part of our healthcare program that doesn't get a whole lot of attention because of the skills that are necessary. But briefly tell us about the personal training and how they're trained to deal with individuals and families. Some of them have to break terrible news to people at times.
Absolutely. Communication is one of the many content areas that we cover in every single program, and we touch on it every single semester. Students have to learn, and future graduates, they have to learn how to communicate with all areas of the healthcare spectrum, from their peers, other people in their profession, to the physicians, but most importantly to the patient and to the patient's families. You're not just taking care of the patient anymore, you're taking care of the whole family unit.
Yes.
And so that is very important to understand. And you're also taking care of a large spectrum of ages. You know, you may be taking care of a newborn, but you're specifically taking care of those parents, sure, because the parents are very scared at that point in time. And so this is something that we really try to hit on. And one thing that helps us with our students is our WES initiative that we do at the college. Okay. And it helps with our it helps with time management. It helps with professional behaviors, professional communication. And we've worked that into our curriculum and in our content in all of our programs to try to assist with that. So when our students graduate, they are not just well-rounded in their content area, but they are well-rounded with those soft skills as well.
My mother is 70 years old, and she is still a practicing patient care technician. Let's talk about that program for a bit.
Well, our patient care technician program has changed dramatically over the past couple of years. Kendra Anderson is our program director for that program. And one thing that we wanted to talk about with this program is that we have reduced this one to a 1 semester program, but you get 4 certifications. And yes, I put my 4 up, 4 certifications in that program. So once graduating from that program, you have a CNA certification, a patient care tech certification, a cardiac certification, and then a phlebotomy certification. So that's pretty significant after a 1 semester program. And that is actually starting this fall. It's one that, again, we've been working on for a while. And Kendra is extremely excited about it. And she has been working very hard in trying to use a lot of the summertime to get this program ready to go for these students who are enrolled.
Excellent. Occupational therapy assistant.
Occupational therapy assistant program. This unfortunately, this program has been hit the hardest with the pandemic, just because a lot of these students are in areas that have not allowed us back in, long-term care and schools right now. And so hopefully we're starting to see a light at the end of or in the tunnel just a little bit with these students. And we're working very hard in trying to get their fieldwork sites completed. OTA just took in their 7th cohort of students for this program. And so we're very excited about that. We are excited about upcoming graduation for our seniors, and over the weeks we're getting more seniors back into their fieldwork sites, and they're going to go through their certification testing. It's called MBCOT testing for their seniors, and that's from our cohort 5, and it'll be over the next 6 months that they'll be testing. They're very excited also because they have some increased technology in their program, something called the ICE. It's ICE videos. And I wish I could tell you a little bit more about those, but it's something that Sarah Odell and has been working towards, and Laura Holloman. Those are our 2 instructors for that program. And they also they've created virtual lectures to increase their student learning. I will tell you, these 2 instructors have been working with these students, even if they haven't been in field work. They have been on virtual meetings with them week after week after week after week, trying to make sure that they keep up on their content and that they're ready for for their upcoming exams. So again, I cannot say anything more about the OTA program except they're awesome down there, and this program is awesome. I do walk in and I feel like I just don't know anything when I walk in that program, because I feel like they are talking Greek to me. It is a language that I don't understand, but I am most impressed with what they do. And it's amazing to watch, the different things that they're learning. And so with our OTA program, these graduates are very well versed in their content and curriculum, and I'm just very proud of our instructors who work with this program.
Sure. Well, one that's near and dear to your heart. We'll get to that. All of them are near and dear to your heart. I know. But you're a nurse, a practicing nurse, and here we are. Time to talk a little bit about nursing and the nursing programs.
All right. Well, with our nursing program, we actually have 3 different routes or 3 different programs. We have our ADN, which is our, when they graduate, they can sit for the registered nurse boards. We also have our PM program, which is our licensed practical nursing program. Our ADN program is 4 semesters. Our LPN program is 3 semesters. And then we have our transition program, which is our LPN to ADN. So those students who have graduated and have a LPN license can actually come back, and in 3 semesters they can graduate and sit for their RN boards. And so one of the big things that we started last summer, I believe, we had a new transition route to open up in Lawrence, on our Lawrence campus, which is a big thing. Again, we've been working on that for quite a while to try to get that that route opened up. And I believe we are actually graduating our first group out of our summer graduates with this transition program. So we're very excited about that. Also, we are going to have a virtual site visit for our program, which, you know, we do get excited about those. We're very excited about a site visit, but that's for our accreditation. And we always learn different things from our site visits. So that's going to occur on September 15th through the 16th. And so that's a big deal coming up with that particular program. One thing I do want to state is that during this pandemic, none of our programs stopped admitting students. And so even though we have been struggling for clinical sites, our instructors have done a great job in continuing to accept students. And that is one thing that our nursing program, maybe compared to some other programs across the state, we were able to continue to accept students. And so all of our programs for fall, we had all of the seats filled in every single program. And that's pretty unheard of during a pandemic situation. So we're very proud of that. And nursing is one of those that we're proud of. And so, you know, they're about to start back in clinical as with the other programs. And Miranda Gaylord is the department head of that program, and she does a phenomenal job with them. And we have numerous instructors. I would name all of them, but I would probably miss one of their names because I don't have a list of faculty, but they are a dynamic group of faculty members over there, and they do a fantastic job with the nurses.
Sure. And your paramedic program?
Paramedic program. This is one of our newer programs, and this one just started with this first cohort. And unfortunately, it did have the impacts of the pandemic. Steve McDade and Steve Hudson, I call him Steve Squared over there, just because I have 2 Steves working over there, but they do a phenomenal job with this program. They were hit hard again, like I said, with the pandemic, with the clinical stopping, but they were able to try to get some of their students back in, and so they're catching up with those. You know, if we had any incompletes, and we are gearing up for our first cohort to graduate. We're hoping that they graduate within the next few semesters. We kind of have to look at when we're able to finish up some of those clinicals, but they do a great job over there, and we're really excited about the paramedic program actually being part of our healthcare division. And so we kind of share that over with our continuing education department. So they're with us, and they're also with continuing education, and we have a great connection with them.
All right. Well, there's one more that I almost that I wanted to ask a question prior to it, but I want you to talk a little bit about veterinary technology as well.
Our vet tech program, I'm super proud of this program. This is our only, I want to say, non-human program that we have. And Ruthie Bust and Tanya Niles and our newest instructor, Melissa Entrekin, and I may have just killed her name on the end of it, but I'm positive that's how you say it. They do a fantastic job over there. And I can attest to that because when I go to the Newberry campus, I always trek back to the vet tech area to see what they're doing with the animals, because I am a big time animal lover. I love to see the kittens and the puppies and the whatever else they have over there at that point in time. And they do a phenomenal job. I don't know if you know it, but they actually have a surgical suite where they can do live surgeries over there.
Mm-hmm.
They work with the Newberry Humane Society quite often to do different types of surgeries. And I've actually taken one of my animals down there to actually have surgery on, and the students, I was just totally amazed. I just the level of professionalism and the level of knowledge, and they just and how it correlates with the human side of healthcare. I mean, it's hand in hand. You're just looking at the difference between an animal versus a human, but they do some of the exact same things. I'm just amazed by it. And
Well, you know, we do have people in communities that, you know, their animals are the recipients of their will.
yeah, exactly. And you know, that might happen with my animals. I love my animals. But anyway, I did want to mention that the employee opportunities are booming right now for veterinary technicians. These clinics have been open as essential businesses throughout the pandemic, and veterinarians are looking for employees to hire. So we love to hear that where our programs are concerned when the employees are when those opportunities are available for our students. And we see those across the board, but especially in areas like vet tech. So we're thrilled that things are booming for them right now.
Yeah. One of the things that, you know, we'll take a few extra minutes here. We, you know, healthcare, your nursing programs, these are very demanding fields. And they're very, very competitive fields, as are your programs. So could you talk a little bit about that, and just to shed some light on the fact that, you know, there's a screening process, if I might call it that, but we have to be very vigilant in ensuring that the individuals that are in these programs are capable, and they have the passion that's necessary and the capacity to do the work, for lack of a better term. But I just want you to talk about the academic rigor of your programs.
Well, yeah, I normally tell people that any healthcare program is probably one of the hardest majors that you can go through. Mm-hmm. Because there is so much information, and you're learning how to take care of a patient and give them the best quality care that you can possibly give them. You basically have a patient's lives in your hands. Mm-hmm. So it's very important with every single aspect of it. And so you're exactly right. We do have a specific process and a specific courses and that these students have to take and have to follow. One thing that I do want to talk about is our Care Plan Center. A couple of years ago, our Care Plan Center was created and implemented. And this is actually when students come in and declare that they are wanting to go into one of our healthcare programs, they are instantly placed in our Care Plan Center. And this is it's a basic advising center, but it also helps them with a case management part of it, where we follow students and we help them to be successful. Sometimes we have to have conversations and state, you know, well, maybe this would be more of a better career choice than this career at this point in time. And it's a lot of times it's just by listening and talking to the student and what they're interested in. Mm-hmm. We have a great course, our AHS 180 course that was established about the same time that we started the Care Plan Center. And it's our healthcare preparations course. Mm-hmm. And it covers all of our programs in this course, and it talks about advising. And sometimes it's changed the minds of students from one major to another major. And what we've done is we've created this healthcare certificate to where our students are placed in this as pre-health majors, so they can actually complete a healthcare certificate before they enter a program, and they can have a skill that they are able to be employed by. So you know, one is becoming a CNA. So it's, you know, I can't say enough about our Care Plan Center. We have a wonderful staff over there. We have wonderful advisors. All of our faculty at the healthcare division are advisors for the Care Plan. And we all have hours every week that we advise students. And I enjoy it. I even advise students, even being the dean, because this is, I continue with a connection with students, and I'm able to talk to them. And then when I see them walk across the stage at graduation, I can say, hey, you know, I advised that student, and I had a part in her education, his or her education, by, you know, pointing them in the correct career path. And so we are blessed to have that center. We are blessed that it is doing the things that we intended for it to do. And I think that it has helped our students to understand the competitiveness, because they realize that they have to score higher in these courses, and they need to be serious when they take these courses, because again, patients' lives in your hands. That's what you're, and patients are from newborns to older adults to our animals. Sure. And so it's the whole spectrum.
Well, Tara, thank you so much. Any final thoughts that you'd like to add? Anything come to mind that you'd like to toss in here at the end to close us out? I'm always impressed with our healthcare programs. I'm always impressed with our students, and it does me as a citizen of all of our communities, going around and being around them all in my line of work at the college, to see so many Piedmont Technical College students trained by our fantastic faculty who are really, really impacting their communities in myriad ways. And it just really speaks volumes for the level of excellence that emanates from our health science programs.
Well, I want to say thank you for having us on PTC Live today. And I want to say us because even though I'm the one talking, I have my faculty is what makes this division. I mean, I could not do anything without them. They are they are everything to this division, and our students are very lucky to have them. And we just, you know, if you're interested in healthcare, please come our way. You know, we want you to find your correct profession. We want you to find that passion. And I think that that's what I see in our students and our faculty, is that passion. And you have to have that with healthcare. You know, I want to let everybody know that just, you know, think about us as our students start back to clinical on August 17th. You know, it's like I've told everybody, it's bittersweet. We're very excited about going back in, but we are sending our students, we're going to the front lines with our students, and they are going to be taking care of very sick patients. And so just understand that they are out there, and they're helping our area and our community. And so we appreciate all the support that we receive here.
Well, we can feel the pride that you have coming through. For those individuals who might be interested in our healthcare programs and getting started in one of our areas, please contact the college here at www.ptc.edu, or give us a call at 941-8000 or 8500 or 941-8324, and you can be directed to the proper persons to share information with you, or contact our admissions office and get the process started. But one thing is for sure, our programs, particularly the health science programs, are having a tremendous impact on our communities. We're looking for people all the time to train and be qualified to go out and help individuals. Tara, thank you so much. And this has been another great session of PTC Live with Dean Gonce, and we will be looking forward to meeting with you next week with another PTC Live full of information about the wonderful programs and the service that Piedmont Technical College is providing our communities. Have a great.
Thank you so much.